Hello everyone, today we're going to talk about anxiety. Now, anxiety is something that most of us are familiar with, whether it's in healthy doses as our system is using it to keep us safe, or if it's at unhealthy levels where it starts to restrict what we're willing to do and not do, all the way up to clinical levels where sometimes people can't even leave their houses. But it is an experience that, at least on the surface, most of us share. Now, there's many different ways to work with anxiety. One of the ways that I will use quite often is cognitive behavioral therapy. Now, the theory behind cognitive behavioral therapy is that we can use our thoughts and our behaviors to adjust our emotions. So, for example, I can think about maybe my best birthday ever, and I can start maybe feeling a little bit of happiness. And if I spent enough time thinking about things that made me happy, I could probably feel pretty happy. If I went out for a really long walk in some beautiful outdoor scenario that I feel really feeds my soul, and I find flowers and I take time to appreciate everything, that type of behavior is probably going to cause me to feel some happiness. I can't, however, wake up one day and decide I'm just going to feel happy and that's it. I don't have that level of control over my emotions, and very few people actually do, if any. And so the focus of cognitive behavioral therapy when dealing with anxiety is how do we adjust the anxious thoughts and how do we introduce behaviors that lower our anxiety levels. Now, the first part of any good cognitive behavioral therapy is usually some education. So when we're thinking about anxiety, I like to think about it as the smoke detector in your kitchen. So for the most part, the smoke detector in your kitchen, I mean, it's there, but some of us, I'm sure watching have experienced a fire. Most of us have not, but we all have them, at least one, if not several in our homes. Now, every once in a while, even if you are a gourmet cook, your smoke detector will go off for no good reason, no apparent reason. Maybe you burnt your toast, or maybe you forgot a pot on the stove. There's no fire, there's nothing actually scary happening, but the alarm system starts going off and you have to go find the button or find the way to take the batteries out and put them back in to do a quick reset. Now, our anxiety system is very much like that. So the anxiety system in our body, which is the autonomic nervous system, when it's activated, it engages a whole bunch of different physiological responses. And if we were, let's say, actually in danger, we would need all of these physiological responses. So we would need extra energy to our muscles so we could run or fight back. We would need to have our breath increase, our breathing rate increase, and our heart rate go up because we'd need it to move quickly. And so in situations where we need to escape or fight back or even freeze, that system is amazing. We absolutely need it. It is what helps us survive. Now, for some people, the anxiety system is a little more sensitive than with others. And so their system will send off false alarms when they encounter something that may cause a small amount of anxiety, a small amount of worry. Their system picks up on it and basically goes off like the smoke alarm goes off when you've burnt something on your stove. So the anxiety system will engage on two levels. And for people, sometimes it starts with the thought process. Some people, it starts with the body shift. So if it starts with your body shift, you may notice that your heart rate's increasing. You may notice that you're breathing faster, that your stomach's upset, that you're sweating, that your muscles are tingly. You may even get some tremors. And as soon as you notice that, because our brain is constantly monitoring our body, our brain will go, oh, something's wrong. So then it goes around and it starts trying to figure out from everything happening to us in our life and that we know about and we're thinking about what could possibly be the problem. And it's going to find something that it's going to land on, whether it be, oh, I just know that I'm going to fail this exam today, or, I'm going to embarrass myself at my presentation, or, I just know that my partner doesn't love me anymore, and, they're going to any day now tell me they're going to leave. And our mind will scramble to find reasons. However, often, well, most of the time, really, these reasons aren't actually rooted in reality. They're just basically focused on, how do I explain why the body is reacting? Now, if you're someone who your anxiety levels start with your thoughts, then your brain starts thinking things and starts sending anxiety messages to your body, and then your body responds. And then you end up stuck in a bit of a cycle. So your body responds, and then your brain picks up on that and goes, oh, something really dangerous must be happening. And then, it starts looking for more danger, and then your body notices that your brain is sending more danger signals, so then it increases. And if you're someone who struggles with panic attacks, you'll know that it builds and builds and builds and builds and builds until, you feel like you've completely lost control of your body and you're going to die. Because often one of the things that people with panic attacks get really fixated on is the fact that they're going to die from what they're experiencing, and it's awful. Now, if I were to work with someone with anxiety disorder, the first thing I would do is have them keep track of what they're thinking about, because you want to become aware of the thoughts going on in your own mind. And you want to notice, am I predicting things? Am I expecting things to go wrong? Am I thinking about what ifs all the time? Am I finding elaborate stories that explain what's going to happen if this thing goes wrong? And often those stories become long narratives that end in like the absolute worst case scenario, whether that's actually accurate or not. So for example, the person worried about failing their exam might say, I just know I'm going to fail my exam today. If I fail my exam, then, I'm going to have to drop out of university, and if I drop out of university, I'm not going to be able to get a job, and if I can't get a job, then I'm not going to be able to buy a house or afford anywhere to live. And before you know it, they've worked their way to living in a box under a bridge somewhere. And so the level of anxiety they're feeling about failing this test is basically on the same level of, I fail this test or my life is if I fail this test, my life is over. Now, that obviously isn't the case, and there's recourse and these sorts of things, but anxiety doesn't think about that. It just runs down that chain. People who function on the what if level, every single thing that potentially is occurring in their life, they think about all the catastrophic outcomes, and they simply think, what if that happens? What if this happens? What if that happens? And you can what if yourself to death, really. You can what if yourself to the point where you can't leave your house because you've thought of every catastrophic thing that's happened, no matter how small or insignificant. And so after you've discovered the type of thoughts that you're having, there are a few techniques that you can use that will help you manage to shift that type of thinking. Now, a psychologist like myself, we're going to have several different techniques to work our way through, different things we can do to adjust. But two of my favorites are actually answering the question, what if? So if you're someone who is a what if person, you'll notice you never actually stop to answer, okay, so what if that happens? I may not be happy if it happens, but what if it happens? What would be the actual realistic outcome? And could I handle it? And we know as human beings, we can handle a lot. I mean, we'd rather not, absolutely, but we can handle a lot. And my guess is that you've probably lived through a lot, and you've handled a lot in the past, which means you can do it again. And so if we go back to our exam example and we say, okay, so what if you fail this exam? What literally actually may happen? Well, maybe the mark would drop. Maybe there'd be some academic probation. Worst case, what if you do get kicked out of university? What would you actually do? Would you really end up under the bridge? Or, would you appeal? Would you go to a different type of school? Would you change your major? What is it that you would actually do? And that allows you to feel a sense of control and ability to manage what's in front of you. Now, if you're someone who builds really long narratives about how the world is coming to an end every time something slightly goes wrong, or not to plan, or is even a mild risk, what you want to do is allow your brain to build the narrative. And then when you get to the end, so for example, our person living in a box under a bridge, what you do is you ask yourself, okay, hypothetically, let's say everything goes wrong the way I predict and I'm under a bridge in a box. What would I do? Well, my guess is you wouldn't stay under the bridge in a box. My guess is, you'd find a shelter, you'd find a way to get a job somewhere, you'd earn some money, maybe you'd get into a small apartment. You wouldn't end up staying there. And so if that actually was on the very off chance to happen, you could handle it and you'd be okay. Now, along with those types of thought processes or thinking adaptations, you're also going to want to incorporate some biological or physiological methods of calming your system down. And my favorite is breathing, any kind of breathing, any kind of breath work. It can be yoga breathing, it can be box breathing, it can just be a simple inhale, exhale, because we know that our heart rate will regulate to our breath. And so if you notice your heart rate is speeding up, you're starting to panic, slow, deep inhales, hold, slow, deep exhale, hold. It's going to eventually slow your heart rate down and things will settle and you will start to feel like you can manage things better. So those are a few things to try. Of course, there are many, many others. If you try those out and you're kind of like, well, this didn't help me. Not everything is the right fit for everybody. So if you are struggling with anxiety and it is causing you to miss out on things or to avoid things you really wish you could do, I would encourage you to look for treatment somewhere, look for help, because anxiety doesn't have to run your life.